Hi, I'm Dr. Allison Feldt. In this video, I'm going to teach you everything that you should expect in a postpartum pelvic floor physical therapy evaluation. So this is exactly what should be looked at when you go in for your physical therapy pelvic floor check after you've had a baby. Let's get started. I'm going to say a lot of anatomical terms. You can go ahead and look those up and I'll try to educate you all along the way. But first things first, congratulations on making your postpartum assessment a priority. The more we heal our core postpartum, the more we are going to have strong cores as we age, and the healthier our core is working for us, the less likelihood that we are going to have different things like pelvic organ prolapse, joint pain, which can lead to years of joint injections and therapies and needing joint replacements, which often lead us to lifelong in diapers because our core hasn't worked. So I don't want that to be you, and that's why I'm congratulating you on getting a postpartum pelvic floor physical therapy assessment. Okay, let's get started. So the very first thing you're going to do is you're going to go in to meet with the provider. The provider is then going to talk to you all about your birth experience. We want to know how long you pushed. We want to know if there was vacuums used, if there was forceps, if you had to get stitches because you tore. We want to know what your first postpartum poop was like. We want to know how you're pooping since you've had the baby. All of these are vitally important to tell us how your organs are recoiling in your abdominal area and also how your pelvic floor is functioning. So the more that you share with us, the better. We want to know all about the aches and pains in your body. Are you having knee pain, hip pain, shoulder pain since having the baby? Do your wrists hurt from breastfeeding or just from picking up baby and feeding? These are all the things that you want to share. It's not just about the pelvis, it's about your entire body. And so we want to know how your feet are doing. We also want to know what was your previous level of activity before pregnancy and during your pregnancy. Are you hoping to get back to CrossFit, running marathons? Are you hoping to set new goals as a newly identified parent or mom? So these are all really important things to share with your provider, so then they can curate a specialized plan for your body to return back whatever you want it to do and also to achieve new goals. So the more you share, the better. Also, nothing is TMI in any of our offices. Let me just give you a little rundown. This is the pelvic floor. It sits inside the pelvis. Babies often come through here, but regardless, even if they come through your belly, the pelvic floor is affected. This is the bottom of the core. The top of the core is the diaphragm. The front is the rectus abdominis muscles, the transverse abdominis muscles, obliques. The back is the glutes and the lower back muscles and these multifidi muscles, all just fancy terms to make up what we call the core. Let's get back to the bottom of the core. The bottom of the core is the pelvic floor. It is made up of 3 layers of muscles. First layer, second layer not pictured, third layer is the deepest layer. Oftentimes, baby, when they come through birth canal, has to stretch these muscles so far that you get micro tearing through the tissue. When you get these little micro tears, what happens when the tissue heals is that the actin and myosin come back together and they form either a knot or an adhesion, and they don't contract and relax as effectively. Also, the pelvic floor starts to work overtime, tightening back together to try and pull the pelvis back together. During the pregnancy process, this joint, the pubic symphysis joint, separates 5 to 7 millimeters all the way up to 9 millimeters during the birthing process. And it doesn't just automatically recoil postpartum. Postpartum, we have to have a lot of the pelvic floor tightening to pull it back together. This does not mean you need to do Kegels. This is going to happen inside the body naturally all the time. So let's get back what the assessment looks like. So that you'll walk into the room, share your story. Once we get through the story and we establish what your plans are and how you're feeling, then we want to see how is your body moving. We're going to look at how you're walking, how you're holding your body, your posture in sitting and standing. Kind of boring, I get it, but it tells us a lot. It tells us maybe your shoulders are tight in the front. It tells us maybe that your core isn't holding you up because it's so weak. There's nothing there holding you up. It tells us a lot squat. Then we're gonna look at how you're walking. Your walking is gonna give us so many insights into your skeleton because it's gonna tell us, are you getting hip extension? Can you use your glutes? Is your pelvic floor overactive? We're gonna look at how your body moves when you touch the ground and come back up. We're gonna look at your hip alignment. So we might start to touch and put our hands right on your hips. And then we're gonna do an abdominal assessment. We'll have you lay on the table. We'll look in to see if you have a diastasis recti. That is the separation of the abdominal wall. We look all the way down from the pubic bone up towards the sternum. We might have you curl up. We might not. We might just want to see how much tension you can generate. Maybe we don't feel it's safe to have you curl up yet. So that part is dynamic. We just want to know, how is your belly recoiling? Depends on how far along postpartum that will test the tissue. We want to know if you can activate your lower abdominals, your transverse abdominis muscles. So we might say, okay, we want you to squeeze your lower abdominal muscles. Then we're going to look at how your hips are moving. We're going to move your hips in what we call internal and external rotation. We're going to see if you have hip extension and hip flexion. And if not, is it coming into your SI joints, the backside of your joints? We want to see how well your pelvis is closing and coming back together. So we might have you sit on our hands and see if your sit bones are coming back together. We might check to see if your sacrum is rotated one way or another, which is very common when the baby comes through the birth canal, to leave you with a rotated sacrum, which then can lead to chronic SI joint pain, which is pain on one side of your low back. That might not creep up until you get back to your fitness routine. We'll look for all of this stuff. Then we'll step out of the room. We'll have you change, pants and underwear come off. Then you are draped with a sheet and we enter the room. We ask for your permission to do a pelvic floor examination. You must give your permission if you want to proceed. If not, we can look externally or we don't have to. And then if you are up for the internal exam, we will test all the tissue. Let me tell you what that looks like. So first, we'll move the sheet back so we can look at your perineum. We'll look at scar tissue if you have scar tissue. Then we just visualize, how is the blood flow to this area? Do we see tissue is nice and has a pinkish tint to it? Does it look puffy? Is it swollen? We look for all of these things. They tell us if you're getting good blood flow, if you're not getting good blood flow. We look to see, is the perineum, which is placed between the anus and the vagina, is that elevated or is that hanging really low and descended? That might tell us that there's a ruptured ligament. It might tell us that if it's very elevated, that things have recoiled and are just extreme, there's a lot of tension there. Then what we're gonna do is we'll spread the labia, we'll insert a finger into the vaginal canal, then we start to test and map the tissue. If you imagine that the vagina is a clock and the urethra at the very top of the vagina is the 12 o'clock mark, then the 6 o'clock mark is the very bottom, which is the perineal body. We're gonna go through and map all that tissue. Now, what this might feel like is sometimes if you have a lot of scar tissue or a lot of tension in the fascia, it might feel like a burning sensation, or it might feel like a fingernail is kind of dragging on your tissue. And if that's the case, then we just back off or we try to break it up a little bit. And we teach you how to use your belly to breathe and use your diaphragm to breathe through this process. Once we go in and we start to move that tissue, then we're gonna say, okay, we're gonna check the second layer. The second layer is composed of your deep transverse perineal body or perineal muscle and also your urethral sphincter. So we'll go up to the urethral sphincter and check that. We'll see how that fascia is moving. Sometimes the first and second layer are just so glued together after childbirth that we just have to work on separating the muscles so that they can function better and that they can get more relaxation and more contraction and just work a whole lot better. Then we go into the third layer. And the third layer is the deepest layer. And we insert the finger to the deepest layer and we check multiple things. All these pelvic floor muscles attached. Do we feel like they are in the places? Or do we feel some floppiness? There might be a pelvic floor muscle tear or an avulsion is what it's called. Then we go and we map all the muscles where they should be. We look at the coccygeus, we look at the iliococcygeus, the pubococcygeus, we look at ligaments, we look at the arcus tendineus, we look at the sacrotuberous ligament. We are just mapping these muscles and making sure there's no scar tissue, making sure that they stretch effectively and they recoil effectively. We make sure that there's good blood flow. A muscle that becomes dehydrated and doesn't have good blood flow tends to feel like a beef jerky. We want that muscle to feel like a juicy chicken breast. A healthy, hydrated muscle is going to be a juicy chicken breast that can really stretch and really contract. And then we go up and we look at this muscle called the obturator internus muscle. So we start mapping all of these muscles. We do it all on one side and then we'll switch to the other side per your tolerance. And then usually when we start to find different areas that have scar tissue or a lot of tension or don't have a lot of blood flow, we work those areas. We want to create new alignment in the tissue so that the actin and myosin inside the muscles can relax and they can contract. And that's much easier to do when you start to break up the scar tissue and stretch the tissue. It's like a massage for the pelvic floor, but you're making improvements, decreasing the adhesions, decreasing the scar tissue, bringing back vitality to the pelvic floor muscle so it can work effectively for you. So what does it mean? We just need this muscle to be able to, every time your foot hits the ground, there should be a little ground reaction force that allows the pelvic floor to contract. And then when it's not contracting, it relaxes. And you don't have to volitionally train this contraction and relaxation. It's going to happen throughout your daily life. So when you do a core workout, you don't need to necessarily think about Kegling or not Kegling. We're going to start to train that in different aspects of different exercises. So really Kegels are an ineffective, inefficient way to really start to get the health of your pelvic floor back. And that's where this assessment is so vital to your postpartum recovery and is an absolute game changer when it comes to having a healthy core for the many years to come. And now let's just say if you have a lot of adhesions or scar tissue, these are things that are going to need to be worked out after session in order to help generate new tissue to lay down, activate collagen to create new elasticity in the tissue, and that's going to help improve the quality of the pelvic floor. And this is all done through this manual work. There's also some other techniques that we can use in different advanced technologies that we use to help get the muscles to become very vital and healthy again. And it's really important, especially if you're planning subsequent pregnancies and or you're done having babies, to get this vitality, rejuvenation, and blood flow back to the tissue before menopause. The more work we can do before menopause with estrogen on our side, the better and quicker the changes are going to happen. So there you go. That is our postpartum pelvic floor assessment. We are also looking at the organ position when you are in our clinic. When we say organ position, what we're looking at is what's the anterior wall look like? What's the back wall look like? What's the cervix look like? Is it coming down too far? Is the bladder dropping in? Is the urethra dropping in? Is the rectum dropping in? These are called pelvic organ prolapses, and we are going to screen you for them. We might look at you on the table. We might look at you in standing or in different positions. If you're having different pressure or you feel like something's falling out of your vagina, we will screen you for the pelvic organ prolapse. We screen everyone. A lot of times pelvic organ descent or some degree of pelvic organ prolapse is very common after childbirth, and I believe it is one of the key factors in women declining as they age, peeing their pants forever, and ending up in diapers and wheelchairs in the nursing home. And it's because these prolapses might be asymptomatic after you have babies, but we have to teach the organs how to go back to their homes. And if our pelvic floor stays really tight and constricted with scar tissue, then it doesn't get that happy relaxation for these organs to go back to their homes. If it's constantly squeezing tight and dehydrated, then the organs effectively start to get squeezed out of their places and they can't go back to their homes. So if you imagine a grape inside of a bowl, the bowl being the pelvic floor, the grape being the bladder. The tighter the bowl, the more squeeze on the grape. The more relaxed the bowl, the more that the grape can just float freely. Well, that's a lot of the reason why we see a lot of incontinence after childbirth, is because our grapes are being squeezed too tight by our tight bowls and we need more opening. Now you might say, but that's not going to feel as good for my partner or for myself. That is not true. The more blood flow you get to these muscles, the more elastin you get, the more that it can relax and recoil, the healthier the tissue is, the better it feels for both partners. And actually, usually it'll be such a drastic difference that even though, yes, you have more range of motion, it actually feels like tighter for the partner just because the tissue is so much healthier. So I hope you found this valuable. Once you go through that experience and you get this full postpartum recovery exam, and then we might test some muscles. We might see, how are your hip muscles working? We will check your pelvic floor. Can you relax your pelvic floor? Can you squeeze your pelvic floor? Can you overextend your pelvic floor? We look at all those muscles. We look at the core muscles. And then from there, we create the plan to get you and your core recoiled and back on track so you can do anything you want as you progress through your postpartum healing. I'm Dr. Allison Feldt. I hope you found this information really valuable. I hope it supports you on your postpartum journey. And most of all, I hope you can be a fit, healthy, active mom living the wellness lifestyle that you want to live through the rest of your life. And can we all just avoid the diapers, avoid the joint surgeries, and avoid the chronic fixing of different pains without getting to the root cause? If all moms could heal their cores after they had babies, we would be looking at a different generation of moms as they get older. Thank you so much for being here. Please like and subscribe and share to all your friends who have ever had babies. If you want more information on this, check out my book, Restore Your Body After Kids: The Secret to Avoid Peeing Your Pants and Achy Joints as You Age. It's a bestseller on Amazon, and I hope you'll pick it up today. Take care.